Okay, so I just started our video. All right, so I was actually the one that asked for this video today, and thank you guys for doing this. Okay, here's the reason. Sterling, Brandon, the two of you it's not that you're unique when it comes to having symptoms that show metabolic inefficiency, so a cell that's struggling in an individual that has motor neuron disease, ALS. But it is to say the fact that you guys came at the same time gave us a really good picture of it, because Sterling, in your case, diagnosed with type 2 diabetes and blood sugar that at times has been incredibly difficult to control. And then Brandon, on your side, blood pressure. Both of you have been on medication. So Brandon, on your side, you've been on medication to lower blood pressure. Sterling, on your side, you've been for a considerable period of time on medication to control blood sugar. And then here's an interesting thing, and the reason we decided to do the video. When we treat over here, we aren't looking to treat hypertension or blood sugar. Those are consequences of cells that are not working well. They are metabolic inefficiencies and often part of metabolic syndrome. What we look to do is get better cellular function in any number of ways, and oftentimes as well control inflammation. What we routinely see is control of that inflammation leads to control of the metabolic symptoms. And so I thank you guys for doing this. The reason I'd ask for it again is one of the more common questions we get. How do you know if the disease is actively progressing? How do you know if the disease is actually kind of moving in the direction of a remission? I think it's fair to say that anybody that has motor neuron disease is trying any number of things. Okay, whether it's a medical approach in a clinic, whether it's a lot of supplements, whether it's mindset and mindfulness, but everybody's trying something. And the question becomes, how do you know if it's working or not? And interestingly, the two of you have very clear metabolic tells. Now, for other people, what they may have is numbers that are not normal for themselves, but still within range. And so for those folks, the goal is to kind of get a sense of, even if blood pressure, for example, is still within range, is it higher than it's been in the past? Or if blood sugar is something that's a little bit high, but not indicative of type 2, are you looking at numbers that are not normal for you? Because if you are, and certainly if you're out of range in those areas, you are likely looking at a pre-syndrome that precedes any number of diseases, including ALS, and again, that's metabolic syndrome, or the failure at the cell level to be able to get the energy and metabolize in the way that it needs to. Okay, so with that in mind, that was a way longer introduction than I thought. I know, I wasn't expecting that either. Okay, but I figured let me just open things up with that explanation. Okay, you guys want to just kind of give an overview? Either of you can start. I don't know if either of you prefer to start first, but I tell you what, Sterling, you want to start first? Sure. Just to not put you guys in that situation. Okay, tell us about your history with blood sugar.
Yeah, so approximately 12 years ago, I got diagnosed with type 2 diabetes and just really had a hard time controlling it, no matter what I did with diet or anything. And the only time I had it under control, I was taking 3 different medications. And the more I researched those medications, I didn't like the side effects. Even though I wasn't feeling them, I didn't want the long-term side effects, so I took myself off the medications. And I've recently put myself back on metformin, which I'm not thrilled about taking any kind of medicine, but even the last 3 years I've been eating really good, and no gluten, no dairy, no sugar, a lot of all organic, grass-fed meats and organic vegetables and fruits. And my blood sugar's still a mess. It's still really high and very hard to control. And the other day, after ketamine treatment, we checked my glucose levels and they were 70, and I haven't seen 70 I honestly can't remember the last time I've seen 70. And then we kept checking them throughout the night and they were still good. And then even this morning, usually after waking up, I have pretty high glucose reading, and this morning woke up and my glucose was 110, which for me that's really good. And then even after eating breakfast and a big meal for lunch, my sugars only went up to 120. So So for me, that's a really good thing. But the 70 blew us away, and I felt wonderful. So
Okay, so then on that day, it was the blood sugar. Tell us about the improvement in function.
when I woke up that morning, my blood sugar was 182,
Hmm.
and
This is the day that it came down to 70
Yeah.
without any medication for blood sugar.
and I had nothing with sugars in it for breakfast, but I came back and my sugars were still high, and then after ketamine, it was a huge drop.
How were you as far as functional changes in movements in your arms?
After ketamine, every time I've had ketamine, I can move my arms and my legs. They honestly feel like a feather. I can move them real high. I can, move them back and forth. I can't go very high right now, but I still have pretty good movement. My legs have really good movement.
So really what we're talking about is two things. The tell, which is your blood sugar, and the functional changes. And so putting ketamine aside for a minute or any other treatment, the question is, can you get control over this condition? And typically you'll see two things. You'll see your metabolic tell improve. So in your case, a type 2 diabetic that's been taking medication for long periods of time, years, not doing anything on our side from a treatment standpoint, except working in the cell. And it was ketamine in combination with a number of other things that have been going on board, right? Lots of other things. The long and short is, first, the functional improvement. So just getting more range, more ability in your arms, and then seeing the same thing from a blood point of view. So seeing it functionally, seeing it level-wise for blood sugar, and knowing, in your case, your blood sugar is your giveaway.
Yeah.
It's the thing that really is telling you how much inflammation you have and whether or not you're going to have a good day or a difficult day, and knowing as well, it's not so much a blood sugar medication approach. Not to say that doesn't work for a lot of people, but it hasn't worked for you.
Right.
Tell us this, the time, date-wise, when you found out you were high blood sugar versus when you were diagnosed.
Oh, probably 10 years at least, from when I was diagnosed with type 2 diabetes to diagnosed with ALS.
How old were you when you were diagnosed with type 2 diabetes?
I was in my mid-30s.
Yep. So I would tell you on our side, from a center point of view, and going back to the idea of a tell. Okay. Anytime you got a 30-something-year-old that's all of a sudden type 2 diabetic, you know there's a cellular change that's gone on. You know that there's an inflammatory change that's gone on. And then ideally, of course, that's the time that it gets addressed, not on your side, but on the clinical side, and not from the blood sugar management standpoint. Certainly that's a piece of it, but the bigger piece is figuring out what would be causing that amount of inflammation. So I'm gonna come on off of you guys, and I'm gonna come on over to Brandon, and I'll come on back. Okay, so for the two of you, so tell us your history. So by comparison to Sterling and blood sugar, Brandon, your history is blood pressure. Will you tell us about it?
Yes, so never had a problem with blood pressure. In 2016, just all of a sudden one weekend I got a headache, and it took medicine for a headache, wouldn't go away. So Monday still had it. She made me an appointment to go get checked out.
Okay, I just picked it back up. I don't know what happened. So you were telling us 2016.
Yeah, so 2016, started getting a headache on a weekend. Nothing would get rid of it. Monday still had it. She made me an appointment. Went to the doctor. Blood pressure was through the roof. So they put me on a medication. It lowered it. And then I went back for a follow-up. I think 2 weeks later, it's high again. So he upped it. So it ended up, that went 3 times. We upped it. So it went up. My blood pressure just all of a sudden shot up. Then been on the medicine ever since, and then since starting my last trip at BodyScience, I was here for 3 weeks. The first week it dropped a little bit, and then noticeably, like, I was feeling it. I'm like, what's wrong with me? And so we had to drop it, and by the time I left BodyScience, I had to drop it again to call my doctor and get it lowered again. I've been plateaued there, with the supplements I take at home from BodyScience, and it's working.
Okay.
I feel better.
Okay, tell us the timing. So when was the finding of the high blood pressure, and when was the diagnosis of motor neuron disease?
2016, the blood pressure, and my diagnosis was in 2021, but I noticed my symptoms in 2019, like, because of my arm weakness. But as I think back, it really started in 2018 because my leg, I had a limp, and I was slower. And I thought because I was doing work on my patio after work, and I'd been doing that for months, and I thought I was just exhausted, from everything I was doing. But thinking back now, it's not the case. So it was escalating. The blood pressure, getting put on an antidepressant for anxiety, it all happened at one time, all within a 6-month period. And then now here I am, fighting through it.
Okay, so then going back to the idea of metabolic conditions and the fact that oftentimes metabolic inefficiency, right, it's what's going to precede any number of diseases, oftentimes including ALS. So ALS for me is kind of the final thing, right? It's when this metabolic mess that is largely the result of liver cells that metabolically can't process sugar and fat properly, and then you see a lot of different cells that are affected, and then ultimately the motor neurons. And so the question is, could you see the pre-syndrome? And in the two of you, you can, right? Because Sterling, again, what's striking is a guy in his early 30s all of a sudden becoming type 2 diabetic, right? So you got to wonder, why is a body causing such inflammation at the site of the insulin receptors? And Brandon, to your point, never having a history of hypertension. And then all of a sudden, in an otherwise healthy man, hypertension shows up. So really the key of this whole thing is, how do you know if you are somebody that has motor neuron, if you have disease control or not? From my vantage point, it's not a question of can you control blood pressure with blood pressure medication or blood sugar with blood sugar medication. And the two of you kind of speak to the same, because in spite of a lot of different medications, and Brandon, you were on 2 different blood pressure medications, right? And Sterling, a number of different blood sugar medications. Oftentimes, people will find those medications aren't even effective, even though they're being titrated up, even though there's other medications being added, and it's because that inflammatory burden, that metabolic mess is driving it, more so than treatment alone. So again, I'm not suggesting treatment does not go on board. I am suggesting if you're an individual with an inflammatory condition, and so certainly if you have motor neuron disease, you want to use this as your marker of how you're doing, right? And you could use these measures to guide you through dietary choices, to know if you're getting enough sleep, to know where mindset is, because you're going to see changes in blood sugar and blood pressure as those things are changing. For a lot of people, if they're putting supplements on board, same thing. You should be able to use even small changes in those numbers to get a sense of which direction you're going in. Yeah. Anything else that you guys are thinking?
No, just come to BodyScience. That's the main thing. You just gotta make the decision and do it. Do the fundraising and get here, and
Trust.
because that's the key. It's motor neurons, and once you get that figured out, things just start clicking.
That's right.
And hope.
Yeah.
This place gives you a lot of hope. You see a lot of reversals. You see a lot of people coming in,
You have to stay positive.
making changes.
Yeah.
Stay positive. If you get down, and that's just going to progress. It's a progressor. Get stressed out, get sad. You're hurting yourself. Smile, wake up, keep going.
Both of you guys, well, all 4 of you, imagine, have been very, very focused on positive mindset through the entire time that you've been dealing with this. We were talking earlier in the day. I mean, that's huge. Mindset is a huge part of this. And then imagine if you could start pairing that up with metabolic markers of how your body's doing that day. You could start kind of sifting through anything else that could be a problem, even if you didn't expect going into it that it was a problem. Sterling, you made the comment, you've been eating healthy, and I agree. But it's funny, like healthy things for one person may not actually be healthy for another. And so the question is, what if you're eating something that's healthy, but in your case it causes inflammation? Imagine, you could probably see it on your blood sugar. And so again, these markers, they become a really, really useful way to navigate day to day and keep levels in range with lifestyle. Because those levels are the ones, and Sterling, again, going back to the idea of you moving your arms. You were walking in the store the other day without your cane.
Yeah.
When it does that?
The day before ketamine, and granted I'd had several ketamine treatments, but the night before ketamine, because some of these IVs and stuff really wipe you out. And so I was feeling drained pretty much the whole time I was here. But night before ketamine, we went shopping, and out of nowhere, I just started walking. I was walking all through the store without my cane. So then I grabbed a shopping cart, and I was even jogging, which I haven't done in 2 years, you know, and so just very exciting. And now that I think back on it, because once you've had sugar issues, you can tell when your sugars are good and when they're not, and the sugars were really good during that time. So again, the marker proving itself, showing its head, and
Yeah.
yeah.
And feeling well. One time, well, several times. If it goes low, so I don't know if there's something to
Yeah,
that.
usually when
Just
it
feeling
drops to
Usually when it
70,
drops,
I don't feel good, but this time I felt absolutely wonderful.
Yeah.
Again, metabolic, right? You can kind of see, you can kind of tell when cells metabolically are working well and when they're not. I mean, I think when people are really metabolic, when metabolic syndrome is there, so cells can't get the sugar properly, they can't get the fat properly, so they're not going through fatty acid oxidation. Most of the time people will describe feeling just fatigued all the time and generally bad. You can tell when your cells are working well. You start feeling the way that you did before this thing ever showed up.
That's how you felt the other night. You said, I feel pretty normal. It was exciting.
Yeah. All right. Well, again, I want to thank you, the four of you guys, for doing this, because my hope is everybody that's looking at this, especially anybody that has motor neuron, right, starts to get clear on ways that they could measure this. We were talking before starting the video. Cholesterol is a pretty good indicator as well, good cholesterol versus bad, but it's harder because you need somebody else to test it for you. But this kind of stuff is easy. Wearable glucose monitor is easy to get. And blood pressure, of course, is easy to take. And so I think we just keep compiling kind of a library of things that people can do at home to monitor cause and effect in order to get this under control as quickly as possible.
Absolutely.
Yeah? All right, I'm going to turn our video off.
All right.
Thank you, guys.